So, how do you even begin to reform an entire nation's healthcare system? It's a huge undertaking, right? It's not about just patching up a few holes. It's about building something that can last for generations, especially when you're up against big challenges like an aging population and costs that just keep climbing. In this explainer, we're going to unpack Malaysia's incredibly ambitious health white paper. It's a 15-year blueprint designed to create a system that's stronger and ready for anything. Let's dive in. And that's really the billion-dollar question, isn't it? This whole plan is built around trying to answer that. It's about looking past the problems of today to figure out what we'll need tomorrow, for our parents, for our kids, and for their kids, in a world with new technologies and new health challenges. The answer, it seems, is a long-term, carefully planned journey of transformation. Okay, so here's the roadmap for this epic journey. The whole 15-year plan is broken down into three very distinct 5-year phases. It's a logical progression. First, you lay a rock-solid foundation. Then you expand on that, taking what works and rolling it out across the entire country. And finally, you enter a stabilization phase to fine-tune everything and make sure the changes really stick. Let's break down what each phase actually looks like. So those first 5 years, they are absolutely critical. Think about it. You wouldn't build a skyscraper on a shaky foundation, right? Well, it's the exact same principle for a national health system. This initial phase is all about putting those essential, load-bearing pieces in place to support everything that's going to be built on top of it later. So what does laying the foundation actually mean in practice? Well, it means tackling the really complex, gritty groundwork first. Things like changing laws to even allow for the bigger reforms to happen later. It's also about getting some early wins and building momentum, taking initiatives that are already being tested and getting them ready for the next stage. It's all about showing that this change isn't just a theory, it's already happening. And this is where it gets really interesting, because you can see they're tackling everything at once. On the service side, they're shifting to family health teams and starting to give hospitals more autonomy. For the money side of things, they're creating a dedicated health fund and bringing in a strategic purchaser. Think of that like a smart shopper for the whole country's healthcare, making sure we get the best value from both public and private providers. And then, for the big picture governance, they're doing the critical planning, like figuring out exactly how many doctors and nurses we need and setting shared goals. It's a really comprehensive way to get the ball rolling. All right, so once that foundation is solid, we move into the middle phase. Years 6 through 10 are all about building on that base and scaling everything up. This is the point where the reforms stop being small pilots and start becoming a real, tangible thing for pretty much everyone, all across the country. You could almost think of this as the national expansion pack. All those successful ideas and structures from the first 5 years, now they're ready for a full-scale deployment. The goal here is to make these new ways of doing things the standard, not the exception, and to roll them out across both the public and the private sectors. And you can really see that shift in action right here. The network of doctors and clinics grows to include private partners, which helps create a more connected system. Things like hospital autonomy and electronic medical records go from being a test run to standard practice everywhere. And, super important, they're focusing on making the whole system financially stronger by finding new ways to fund it and expanding the benefit package, which is basically the set of health services that every single person is guaranteed to receive. Okay, so we've built the foundation, and we scaled it up nationwide. Now what? Well, that brings us to the final 5 years. This is the stabilization phase. The really heavy lifting is mostly done, and now the focus shifts to refining, optimizing, and making sure this new system is built to last. You see, by this stage, the big, fundamental changes are already in place, so this final phase is all about making the whole thing sustainable. It's a time for fine-tuning based on real-world data and feedback. Making small adjustments and course corrections to make sure everything is running as smoothly and effectively as it possibly can. So, what does the finish line look like? Well, the vision is a health system that's no longer this fragmented patchwork of public and private options, but a single, seamless network that works for you. Public hospitals and clinics are operating with more independence. Cool new tech, like wearable health trackers, becomes a normal part of public health. And the whole thing is backed by stable, reliable funding, with policies that are constantly getting smarter because they're based on data. But hold on a second. 15 years? That is a long time. I mean, think about it. Governments can change, budgets get squeezed, priorities shift. So the big question is, who makes sure this whole thing actually stays on track through all of that? Well, the authors of the Health White Paper thought about that, And they have a pretty clever solution. They call for creating a totally independent body to basically act as the guardian of this entire reform, making sure it keeps moving forward no matter what happens over that 15-year period. And let's be clear, we're not just talking about another bureaucratic committee. The whole point of this is to create a truly independent, nonpartisan body. Its only job is to watch over the reforms, give expert advice, and report what it finds directly to Parliament and, just as importantly, to the public. It's designed to be a check and balance to keep the whole journey honest. So how does this watchdog actually work? Well, it's a pretty straightforward 4-step loop. It constantly monitors how things are going. It analyzes what's working and what's not. It reports its findings so that everyone, politicians and the public, is in the loop, and then it recommends changes. This creates this constant cycle of improvement and accountability, which should make the entire plan more flexible and resilient over time.
So when you put it all together, this massive 15-year plan, plus the mechanism to keep it on track, the Health White Paper ends with a really powerful call to action, a call for unity. Because at the end of the day, that's what this is all about, right? The ultimate prize is a health system that people actually value and trust. A system that isn't just putting out fires, but is built from the ground up to handle whatever challenges tomorrow throws at us, making sure everyone has a chance at a healthier life.
And there's a quote from the paper itself that just hits the nail on the head. Before more time is lost, the Parliament, the people, and the nation must stand together and begin the journey of health system reform today. It really drives home the urgency and the fact that this can't just be a government project, it has to be a national one. You know, a plan of this scale is a massive commitment. The roadmap is clear, the vision is compelling, and the call to action has been made. But a 15-year journey, well, it really does start with that very first decisive step. The only question left on the table is the nation ready to take it together?